Insurance Committee. So if any of you have anything to add, I welcome that. I'm giving you the end of the year, the end of the calendar year update on our health insurance. So we're looking at the health insurance plan for 2017 and how that plan ended. So I'd like to just start by showing you how the claims have been running over the past few years. So on this slide, you'll see 2014, 2015, 2016, and 2017. You see the breakdown by month, and then you see the totals as well. And you'll see regarding the totals that we are remaining relatively flat compared to 2014, down slightly from 2015. And then the 2016, I'll just point out, as I often do, that does not include the reimbursements. Those totals don't include the reimbursements that we got from our reinsurance. So we're going very well as far as the claims. And I think that is partly attributed to things that we have implemented to help maintain our claims. And that would be strategies that have been put into place, the expansion of the Health Insurance Committee, educating our employees on to how best utilize the health insurance plan, and the Wellness Center as well. This breaks it down even further. This shows you the 12 months and it breaks it down by medical and pharmacy. I don't have the breakdown yet for the month of December. We just got the claims we just got the December claims the end of last week. So that's the total number that we get at first, and then it takes them a few days to break it down further and to give us more detail about what the claims look like in the month of December. But we did have our total for December, which was a little high. But then if you look at those months, we anticipate typically October, November, and December being high. We had a good November, relatively low for the month of November. Also, those summer months that we anticipate, and we get hit pretty hard sometimes, June and July, those ran relatively well this month, or this year as well. So the next slide just shows you what the average claims are, the January through December, what the annual totals were. So you'll see the 2014, 15, 16, and 17. That was claims, the average per month. And that's just showing you in graph form. And again, the fact that we're able to maintain, back in 2014 we were at 842,000, 2017 857,000 in our claims. When the claims trend is running 8 to 10% increase nationwide, and we're staying relatively flat. As you know, this past year during open enrollment, which was in October, we did have a tougher year than usual as far as our premium increases. The premium increases went up 8% across the board, and that increased our revenue, of course. So the average monthly premium revenue in 2016, we were averaging the 1.150 for the average monthly premium as far as revenue. And then in 2017, we were able to increase that, which has made our plan much more healthy. Definitely at a better place this time this year than we were at this time last year. So I have these quarterly, I'm looking at slide 7. We have these quarterly sheets that I share with you on a quarterly basis. So this is not new information to you. You've seen quarter 1 and quarter 2. So now I have also for you the quarter 3 and the quarter 4. So let's focus on slide 10, the quarter 4. So if you'll just look at that, I'm just going to kind of go over the format real quickly with you. If you look at the monthly budget, that's what we plan for throughout the year. And then it shows you the actual numbers. It's just capturing that month, a snapshot of that month only, the month of October, November, and December. So when you look at the revenue, we talk about the premiums. Then we also have what we consider other. That's pharmacy rebates we may get. That is some payback we get from transportation for the bus driver physicals that we do, and also interest on the money that is in the bank. So those vary slightly, but you'll see the October, November, and December, and that's the total revenue for those months. Then you'll see the expenses. We have our claims expenses. We have the Florida Blue admin fees that we pay on a monthly basis. We have our reinsurance premium that we pay to Symetra on a monthly basis. We have our Care Here bill. That includes the Care Here program fees, the service fees, which is what we pay our providers, the doctors, etc., and then also the pharmacy expenses at the Wellness Center. Then we have what we call Wellness Center Other. That includes things such as the garbage bill, the electric bill, the rent, those types of bills. And then the category that we call Other, that would be our Affordable Care Act taxes, our postage, and some fees we pay to a cancer advocate on an as-need basis. So then you'll see our total expenses. So let's look at the month of October. You've got your total revenue, you've got the total expenses, and then net, how we ended up for that month. October was a little high in the claims, and we ended up at the negative $18,000 for that month. Then you'll see that line called aggregate specific pooling. And what that is with our reinsurance. We set aside, our premium states that we're responsible for the first $670,000 of our extremely high claimants. So we do budget for the worst case scenario if we need to use that entire $670,000. So we do budget for that. So up through the month of November, we had not had to touch any of that $670,000. But we did just get information today, Mr. Bishop and I, and this is as they broke down what the claims were for the month of December, that we have had to use a significant amount of that $670,000. But that's why we budget for it. And just a quick reminder on that is we monitor our extremely high claimants, and that's when they reach $175,000 for that particular person. So anybody that hits $175,000, anything above that, for the first $670,000 of that, we're responsible for. But after we meet that $670,000, that's when our reinsurance kicks in and pays the remainder of that. And that can be a combination of employees as well. We may have 3 or 4 employees or people on our plan that are over that $175,000. We only have to pay the $670,000 of all of those collectively.
The $175,000 is the mark.
Yes.
The 600 and what was it? 660.
670,000.
670,000 is what's over that amount.
What we have to pay of any claimant that goes over $175,000.
Okay.
But the most we will have to pay is $670,000. After that, the reinsurance will kick in. So for example, 2 years ago, we used all of the money that we had pooled and put aside. Last year, we didn't have to touch that money and use that. This year, up until November, we hadn't touched it. But December was a tough month on those high claimants. And so we're only going to be we're having to use all of it except $134,000 of that.
I thought the reinsurance kicked in after the threshold, $175,000 was met. That starts the reinsurance. Well, it sounds like what you're saying is if they go over $175,000, then we only are paying the $670,000, right?
And it's collective. It can be more than one person. So let's say 4 people are over $175,000.
Right.
We have to pay those bills still until we pay another total of $670,000 out of our plan.
Okay, right. Okay.
And then it kicks in.
Right. Okay.
Yeah, if you don't mind, when we were trying to figure out premium increases and what have you, to reduce the premium increases for our employees, we actually bumped up. At one point in time, we had like $330,000. That was the threshold before reinsurance kicked in.
Right.
But in an effort to reduce costs in terms of premiums to our employees, we upped that to $670,000 so we get a lower premium for the reinsurance fee. Because as you can see, I can't put my finger on it right here, but we've had about $50,000, the reinsurance premium was between $57,000 a month, about $52,000 to $57,000 a month for that reinsurance fee. So we spend a lot of money on that. Imagine if we didn't bump that threshold up to 670, it would be extremely expensive. But yes, that's how it works. Once we get to 670, we start getting the reimbursement.
And that protects us for huge $1 million claims that could come in against our plan that would wipe us out. That's why we pay for reinsurance.
That's what allows us to be self-insured, basically,
Yes,
is that
correct.
we have to buy insurance on the insurance.
Right.
You know, reinsurance.
That is correct, yes. So when you look at each of those months, January through December, and I take the net and I tally that across, I come to the fact that we have ended up 850,000 to the good. I'm gonna get my numbers in front of me. 850,000 to the good. And then,
But that's not, where is that on that slide? I don't see it on that.
it's not.
Okay,
I just took the nets. I took the net January through December.
right.
And our plan is 850,000 to the good. And then we had that 670,000. Do we need to use it? Will we not have to use it? So we can't add in 670,000, but I can add back 134,000 of that we're not going to need. At best tally that we got this morning. These can fluctuate somewhat. So that would leave us at the 830,560, and then I can add in 134,000, which leaves us to the good 964,000. And that's just for January through December. Remember, we started January 1 with some fund balance. So we still have that fund balance we started the year with. But January through December, looking at how our year ran, we ended up 964,000 to the good. Whereas at this time last year, looking at January through December, we were in the negatives. So we've done a much better job with planning and preparing for the year.
How many claimants do we have that meet the reinsurance?
He only identified 2 for us this morning that added up to that. I don't know if those were just the 2 largest, and there may have been a couple of others that affected us slightly. I don't have that data yet. There's, like I said, the claims just came in the end of last week, and we've not gotten that breakdown. We are meeting tomorrow with Crown, and we hope to have those details.
Can I add 2 things there? Yeah, as she said, we were identified 2 high claimants, but it's very important for us to know, and for the folks out there to know, we don't know who those people are, we don't know what their ailments are, we just know that we have 2 high claimants. There's laws that protect us from knowing that. When Ms. Turner shares with you that we're 800,000 plus to the good, please understand, if you remember year before last, we came before the board and said we had a very strong concern because we were deemed we were not deemed actuarially sound. So this is part of our 3-year plans to work toward actuarial soundness by increasing revenues and trying to decrease expenses. So our plans work this year. When she sits here and says we're 800 plus thousand to the good, we're 800 plus $1,000 closer to being actuarially sound. We're not there yet. Keep in mind we have to have in reserves a fund balance that equals 2 months of claims plus a month and a half of claims for the run out. So we really need to have about $3.5 million or more dollars in that account. We're working to get there. I think the actuary is pleased with our plan. We're working our plan, and so we're pleased today to share with you that we're inching our way closer to where we need to be.
So the actuary obviously still has the work to do, but you don't think he's going to come back and ask for the board to have to add to the self-insurance fund, correct?
Our best estimate at this point in time, based on where we were last year and what he required and where we are this year, we don't anticipate that to happen. We have just sent information to him. He's asking for more information, so we're in the process of working with our actuary right now. It has to be submitted by the end of March, but we hope to have it done much sooner.
And those would certainly be part of the conversations we have with Brian Brown at Crown tomorrow, in our meeting tomorrow.
Okay, good.
Sharon, just a point of interest on the revenues. At the end of each quarter, you know, the March, the June, the October, they're 5-figure others. And then in December, we drop down to 4 figures, only 7,333. What is the source of that end of the quarter revenue that's seems to be coming in the end of every quarter, but didn't appear?
It's typically the pharmacy rebates that makes it increase.
Right.
We get those pharmacy rebates quarterly.
Okay, and so, but it just seems like a big discrepancy in December, we got
Yeah.
nothing.
Yes.
And just for a point of information, are you guys familiar with how the pharmacy rebates work, how we get that money back? When the prescriptions are prescribed that are only come in generic, in brand name form, when they're filled at the pharmacy, the insurer does get a rebate for dispensing a brand name drug. So that's where this money's coming from.
All right, so we didn't get anything in December, huh?
You're looking at revenue other?
Revenue other, we got 63,911 in March. We got 65,424 in June. In October, we got $79,045, and in December, we got a little piddly $7,333.
We may not receive that quarterly check until January. It may not get posted until January. It just depends on when we get the rebate check.
Okay, so it might show up.
It should still be coming.
Okay, all right.
These could fluctuate. Things could come in that will still get posted to December also.
Okay.
Okay, moving forward. If you look at, we're looking at slide 11, I just wanted to share with you during our open enrollment, the migration in December, how we ended our year with the 1653 plans. And then in January, after all was said and done, after our open enrollment, we have 1640 as far as the plans. So a slight decrease. We always do anticipate a little bit of an increase. Most of the time it's attributed to retirees that might be reaching the Medicare age.
Am I correct, the 5172 plan is the required plan at
Yes.
this time? Do we know, with the changes taking place in the tax laws, there's going to be less, even more encouraging reason for them for those 82 people to necessarily be in that plan, because they're not going to be penalized, I believe, on their taxes if they're not in that plan. Is that our general understanding? Because I think that's correct.
We don't know yet how anything that is new might affect our plan. It could be that we don't have to we won't have to
that was
offer
really
that
kind of
plan
where I
any
was going
longer.
without having to have you
Right.
answer that. But so there is a question.
That's
At this point, it's too early to know what that could impact as
that
far
is
as
a possibility.
And I know it's not a huge number, but we are, if I recall, subsidizing those
Yes.
plans with the other plans in order to make those within the margins they need to be.
Correct. And
But they are not using the wellness center.
that's right.
They are not, which is, I'm sure, why we've migrated.
We've corrected that, but we've helped correct that by not allowing the wellness center.
Right.
Okay, this is our wellness center utilization, and just to share with you the fact, if you look just at the Inverness Wellness Center, when I say both schedules, I mean the sheriff's office and the school district. So both schedules utilizing the Inverness Wellness Center, that would be the capacity number that you see there. When I break it down by school district, of all of the use at the wellness center, 73% of the use is by school district employees, and the balance is by sheriff's employees. Some of those numbers started to concern us. We felt like our utilization was getting low. We don't want our providers sitting there idle. We want to make sure they're seeing our folks. So we implemented some strategies to help correct that. If you look at the next slide, you see that we are trending higher, and we're continuing to monitor that and implement strategies. You look at November and December, where our utilization numbers have increased, 89%, 90%. That's more like where we want to be, possibly even a little higher. So we are working on that. We do that by perhaps cutting back provider hours if necessary, whatever it is we need to do to help increase those utilizations, reminding our folks to utilize the wellness center.
Have we found that, like, I think we've done away with weekend hours. At one time, didn't we have Saturday hours during the early stages?
We still have Saturday morning hours at the Beverly Hills Wellness Center.
Oh, we do?
Yes, we do.
Okay.
Mhm.
So that's,
And that's a
because what
popular,
I
those are
wondered.
popular time slots.
And that's what I was going to say. I wondered if there was, if the timing and use, catering sometimes to the afternoon, evening, is really part of the issue as opposed to the early morning. But I know we have to have a certain there for blood draws in the morning, so it's probably a balancing act trying to pull it off.
One thing I'd like to lift out is the requirement that our self-insured having a wellness center requires active management. And I can tell you, Ms. Cernich, she does a very awesome job meeting with Crown and Care here about once a month. We look at these utilization rates. There's a couple ways you manage this. Either A, you have to increase your utilization, or B, you have to reduce your costs, your financial liabilities. So when we see our utilization stay somewhat flat, we look at a couple of things. What can we do to better promote the wellness center? What can we do to improve on the services provided at the wellness center? But we also asked Brian Brennan, where are we going to start cutting expenses? And that really has to do with staff. And a large portion of those expenses rest on staff. So rest assured, tomorrow when we meet, Ms. Cernich and I met this morning, we're going to talk about utilization. Because I was very clear with them a year ago. I like for it to be about 100% utilization and not 79, not 80. So that'll be our conversation tomorrow, but Sherry does a very good job in monitoring those expenses and the utilization rate, because that's the way we have to monitor that. So
Well,
I'm sorry.
yeah, we also, have to continue to educate, because I see people out there, especially with the prescription meds, that they can go there and get it for free, and it costs us a whole lot less than them going and filling these prescriptions. So, we still have to continue to educate, and, I would like to see those utilization rates up, but, on the other hand, you don't, we've got some good physicians there too now, and you sure would hate to lose some of those physicians that are there. So go ahead, Mr. Kenny.
Well, I was just gonna say, I know, again, we have to have blood draws, so we have to have some morning hours, but I'm wondering if, have we looked at having some days where we have morning hours, other days where we had later hours, to ensure that we are, because I know as a parent, if my kid's sick, it's usually I need to try and find a way to get there in the evenings or on the weekends or whatever the case may be. Well, I know they're working kind of regular business hours, banker's hours. I don't know if there's any utilizational increase if there's been looked at if they have evening hours. And then on those days, in order to keep costs, you have them start later in the day. So you might only have blood draws that you can do, Monday, Wednesday, Friday, but you have 2 other days where they can go late into the evening. I don't know if, because I'm thinking utilization is also dependent on if I can get in. When we had flu season, and when we've been in it, I will tell you, I went in there and they were out of the medication. The good thing was they had to give me a script, and they said, listen, we can do it a couple different ways. I was shocked, it was $4. So, and that was for I think it was for a V-Pack or whatever, Z-Pack or whatever. I was like thrilled because I was thinking, listen, I got in. The $4 was cheap because I was spending more of that in cough medicine. But it was kind of because if I had gotten that appointment at that moment, I couldn't have gotten an appointment for 3 days. So I know someone's utilizing it, but I don't know if it's always, I don't know if that's just a factor.
And the morning slots are real popular too for the schools that the elementary staff
They're
starts
going
later.
before.
They're taking up those morning appointments too, so I don't know that we'd want to take those away. We did extend to 6 p.m. We used to close earlier in the Beverly Hills office, so they're open until 6 at this point. It is something we've talked about as far as the Inverness location, so that's something we can continue to look at.
It's a question of, is there anything we can do? You know what I'm saying? Is there something that's not going to cost us that we might be continually monitoring? And I know you've been doing that, but
anytime anybody has thoughts, we like to look into them. Okay, and you mentioned, I just wanted to touch on, because you mentioned the pharmacy and getting the prescription at the wellness center, and we do have the mail orders now.
Yes.
Because when you saw that breakdown of how much we spend on medical and how much we spend on pharmacy, we spend a lot on pharmacy. So that's why we do encourage people to get their prescriptions filled at the wellness center. We implemented the mail order just a couple of years ago. So we try to, and as you all have said today, keep that in front of them, keep educating them and keep reminding them of the things that they can do to help our plan. So lastly, the no-shows. We have the no-show policy. It starts over in January, so we start over with a clean slate on January 1. A person's first, or the plan's first no-show is a bit of a warning, and then, although we do make a contact to them, and then the second and thereafter throughout the year of anybody on one plan is a $25 fee. So you'll see that for the year 2016, we had a total of 483. For 2017, we still have a total of 416, which it's not as much a reduction as we would like to see. It was 13.5% reduction. It's better than nothing, but it's not a big reduction. So that's something we've had conversation at the committee with. I wanted to have conversation with you. Should we be more aggressive about that? It's a $25 no-show fee. The talk has been perhaps increasing it to $50. So I don't know the feelings of the board.
what is 416 costing us? I mean, there's got to be a factor of what it costs us for a no-show.
Yeah, $41,000.
It's $100 per slot, although it's probably
That's what
more
I was thinking.
because
It's-
some of those are 2 slots. 2 slots counts as 1 appointment. So at a minimum, it's what Mr. Bishop has said.
So it could be as much as $200
Yes.
on certain.
Yes.
I think the committees will all be wanting to hear what they have to say, but I hope the committee understands that's a big amount of money.
The committee's been very aggressive in wanting to increase the no-show fee from $25 to upwards of $50 because they don't feel that we're getting the deterrent factor that we're hoping because it's costing the plan, costing everybody in the plan money.
Maybe it should be 25 the first time,
Could be.
50 the second time.
Or a percentage if they booked 2 slots, a percentage of the slot. 50% of the slot.
They did say it would be kind of a bookkeeping nightmare if they vary. If is this guy getting 25, 50, or 75 fee? That could become pretty labor intensive.
We don't
But,
want that.
but increasing, those are good thoughts. And then also, do we need to start it over fresh every January? Maybe not. But
As the billing nightmare would be the question. Is it if it's harder to do it one way or the other? If it's not, then why do you get a new chance at the new year?
right?
You've already shown.
Yeah. Yes. Okay.
I'm not
that would-
real big on increasing the fee myself, but I certainly think the committee should look at the big picture. I mean,
Well, I think we thought that by penalizing them for not showing up, that those numbers would
Yeah,
be
we
much
did.
lower than what I'm thinking.
Yeah, they're not low at all.
Yeah.
Doesn't seem to be doing what we had hoped.
Yeah.
yeah.
But it means the
$41,000.
30. Yeah.
My house cost 45 when I built it back in.
And 30 means that, we're only capturing a fraction of those that are thing, because I'm assuming that of the 416, most of them were first-time offenders. Because we only do it on the second one, right? So only
Right.
30 rose to the second level.
32.
32, you're right.
There are occasions where one person has booked 3 back-to-back appointments. They haven't
And
shown.
can't.
I've seen the
And not shown.
social list, and there's quite a few of those where that's happened, so that's an hour and 3 appointments that are not being taken by other people. Certainly a conversation at the next insurance committee.
So you need to
Yes.
call them, like, just when they call them and
Mr. Ballard.
see why they're missing?
Oh, I'm sorry, now it's back to papers.
Yes, we do. Phone calls, emails, yes.
Which then costs more to the district when you do that. It's more
Yes,
staff that's
correct.
doing that. too.
So we're at 50 or 60,000, I'm just asking.
Well, that's why I go back to, I don't know the other way other than to maybe state that you're gonna do it on the first one. If I go to my private physician, I don't get a grace on it. If I don't show up, they hit me.
Okay, that is a good thought.
They also call it before, like they must have robocalls now because I'm getting them and it's just a recording reminding me I have an appointment. Call if you can't make it. No, I'm my private doctor's.
They text
And we
me.
do that. You have a choice. You can be emailed, text, or phone.
To
Or I'm
remind
not sure about
you.
phone call, but email or text to remind you.
Prior to their appointment. that
Mhm,
they have.
yes.
Yes, they do.
Well, then I think we'll start this.
And I was gonna ask, can you call now for an appointment, or is it still just computer?
It's online, yes.
So a person who's ill and needs to go, what do they do?
Can be online, but I have people who call our office and we get in there and do it for them and help them. I mean,
That's good, because I
Right.
think of a person ill, they're going to.
I would call you if I was
3-day
sick.
appointment.
I'd call
You
Sherry.
show up down
Yeah.
But again, I
We
go
try
back
to accommodate.
The money, the 416, is not, the money is a big deal. But that means that's potentially at least 416 times, or over one a day, where someone could have gotten seen
mhm,
who couldn't make an appointment that day,
right.
That's right.
that we could have gotten help for. And that's the other,
And the other thing of concern is there's 380 of them that are gonna do it again because now they're gonna get a free buy for one more appointment. So
Good point.
I'm thinking insurance committee should look at,
I do too, I agree.
it's a continuation
It
of the
doesn't get a
process.
restart.
It's not a,
yeah.
It doesn't
there's no
restart.
restart yet.
Yeah, I would agree
one
with
crack
that,
and you're out.
Okay.
but we'd have to start it this year, because.
I think-
Yeah, I don't think we can.
No, I agree.
Well, then
Right.
do graduation rate.
Very good, very good.
I was at some place.
Yeah,
today,
anything we do, I
and
guess
a
we
person
can't do
had gone to the
until-
clinic, and they were very excited about the alternative medicine program they had. Now, I know nothing about it, so I couldn't comment. I didn't ask you what, like you're talking about, No, but I didn't know what alternative, they were talking sort of like maybe yoga or something, I don't know, or maybe they weren't, maybe they were talking something else. Well, what is the alternative medicine program that's at the clinic?
I'm not aware of it all. I mean, I don't know that they're,
That's what you called it,
I know
alternative
we've got.
medicine.
There was
several
something, by the way, about
teachers-
that, I
yeah,
forgot, there
We've got several
was
teachers that
something.
are going to that citrus alternative, and it's for acupuncture for stress.
yeah, I'm not aware of alternative
No,
things.
it's citrus alternative.
No, this was at the clinic, they were saying they liked the alternative medicine program, it's really good.
Our clinic said that to you?
The patient who goes to our clinic said that. They
Okay.
were thanking me for putting it. I didn't even
We
know
haven't heard
what
about
it
that, but I promise you tomorrow morning, 10 o'clock, we will. Yes. We'll find out about that.
What kind of jelly beans?
We are not familiar, but we can definitely
is.
research that.
No, if they ask me something again.
We will let you know.
Thank you.
Okay,
Yes,
thank you.
yes, thank you very
Good
much.
job, good job.
Thank
All
you.
right, now, we did have one more item Mr. Mullen wanted to bring up with the AES 7
Yeah,
period.
I know there's been some questions about what are we gonna do with AES, and since we're coming into that part of the year where many of our students will be signing up for the academies at their middle schools and high schools, I asked Mr. Rowland to come let you know what we're working out, what we're gonna be proposing to the board and the pupil progression plan later this year.
As Mr. Mullen said, before Christmas, we decided, or our high school principals decided they wanted to move to a 7-period day, and they wanted to move to it next year. So they began working very hard at scheduling students, and the other big question is, how does that fit in with our AES plan? Well, it doesn't fit in with our AES plan, so Mr. Leonard has met with all the high school not all the counselors, but counselors from each school and assistant principals from each school to talk about, what their thoughts and ideas were for a transition. He and I have had some major conversations about what can work at AES, and the plan that was established, or not, that we came up with, is this: that 9th and 10th grade students would attend all year, beginning next year. And these are the courses that they would take. And again, these were done in collaboration with the high school counselors. Like, how's this plan going to work? And Mr. Leonard also even had conversation about, if you want those students to transition into your academy, what are some suggestions for the courses that we offer? So this is the courses that have been laid out, that again, that we'll bring to you later on for approval. But this is what we presented on our academy night. We had that about a week ago, heavily attended. All 4 middle schools had a lot of attendance there. Parents love that. It's amazing that the success that it's had.
I have 2 courses I don't recognize. What is HOPE?
Hope Health. It's a health and PE course.
Oh, good, okay. I got that, and limnology.
It's the study of inland waterways.
All right, okay.
Good for a while. He had those ready. I just have a sneaking.
I didn't know what it was, yeah.
And hope.
I've actually seen that when we have our Save Our Waters Jeopardy. That's come
yeah.
up several times.
And hope is something you're going to probably be talking to us about in general. It's not going to just probably be AES, but we're going to be having conversations about that.
Correct.
Not bad. I say that in the positive
Right.
way.
The state requires 1 credit of PE and health, and we have typically required 1.5 credits in the past. And by going to a 7-period day, that will be another item that we would talk about in our student progression plan, is to simplify that.
Good.
And so I just wanted you to be aware, because I know sometimes you get questions out in the community, and so it just gives you a little bit of information if someone asks you a question.
And I know that we talked about this a little bit during our break, but my question was, their board is in agreement with this plan, correct? And you said they're...
That's my understanding. We've had that conversation with Mr. Leonard. Yes, they are in agreement with that. The working relationship with AES has been very good. I know they transitioned some members on their board. I know Mr. Leonard was has transitioned in that position, but it's been a very collaborative effort from everything we've done thus far. And they're willing to it's a give and take relationship, so it's been working out pretty well.
Mr. Leonard's really reached out to the schools, and that I think has gone a long way at bridging this. The challenge that we have is, and while 7-period was something we looked at that was best for our students, we knew, and Mr. Leonard was in on those conversations, I mean, intimately, and he knew he was having to be part of a conversation that was gonna create some challenges for AES. But it isn't easy to know how to marry up these two programs. I think he's being some creativeness. Looks like he's trying to tie in with like IB, and kind of making a pathway with certain schools' programs. And I was really applauding that because pathways is something, and a pathway guide is something I've appreciated. I think this, again, goes along with those conversations. I will tell you, since the beginning of the year, or I should say since vacation, I don't go many days without getting large conversations, and actually I'll tell you, Lecanto being one of them, of parents hitting me up about pathway guides, that they need help with that. So I'm appreciative. I know you're working on those. This to me just fits along those lines of that.
Amy, can you address with this plan, the data, testing data from students taking the 10th grade ELA will come back to their home school, is that correct?
If the students are at that school all year long, they would not go back to the school. They're correct. If they are
But
there
it
for
will
both
reflect in
activities.
the district's data, but not the school's
No,
data.
AES would then get a break.
Okay.
They do now, though?
They don't this year because they do not have any students that are there year long.
They have in the past.
That's okay, that's what I was thinking.
In
So
the
they would
past, yes.
again start getting
A school break.
a school grade.
When I talked to Mr. Olson last week, because he oversees it from our standpoint, many of the staff members he talked to at AES felt like this was going to actually be better for them than their current setup.
I just bring back the point of, we've got a senior who wants to go into marine biology or some area, and they're not gonna have a chance to go there for one semester of their senior year. I mean, that's not even an option now, right? I mean, we're gonna have a 9th and 10th
They
grade.
wouldn't be able to offer any courses that student would
Right.
take.
In our high schools, I believe all our high schools offer a marine biology option.
Right.
So,
And AP.
Yeah.
and AP.
Well, and again, but I was just saying that a chance to have that hands-on that the AES does offer, to students.
Well,
That
hopefully that student would have been in the marine science, maybe 1 honors and 2 honors as 9th and 10th graders.
You mean AES?
Right, they might have participated, that student you're talking about as a senior.
Right.
As a 9th
Yeah.
or 10th grader.
Yeah.
They could have.
And that's just why I just want to make sure everybody's, I'm okay with this, as long as they're okay with it, that they agree with it. It sounds like what has been discussed here, everybody likes this, so.
The
I just
challenge
wanna
that
make
we continually are gonna have is when we have to graduate those students. As long as we're graduating them, then our ed services needs to be involved in that development and process. If at some point AES decided they wanted to do a different route and they didn't want to involve our ed services, then, and I don't think that's the case, by the way.
No,
I don't think
no.
that's the case, but that's where the complications challenge is how we marry these two systems up.
Right, well, and everything's changed, right? Because our big argument is we want them to be in at least one semester, or the first semester of their freshman year, we want them to be at their home
Right.
school, so that they will get acclimated to their home school environment. The guidance counselors can meet with them and make sure everyone's on track. Well, again, now we've moved totally away from that, but that's because.
We get seventh year, yeah,
Yeah,
I mean, there's no way, I think, to do that. with
Right.
No,
seventh
there's
year.
no real option of that, because the
Yeah.
partial day just doesn't work with transportation, and with year-long courses, you can't go a half a year.
Right.
But, the advantage, and I had a chance to talk to Mr. Leonard about some of this too, because I had the same concerns you do. There really is a case to be made, though, that for those, particularly the higher order students, this could be the perfect blend, because they could really get immersed with the marine biology and the sciences, and then go back to their base schools where we do have sometimes a little stronger labs environment. I know Crystal River has a very strong AP chemistry program and, and higher math options that AES can't necessarily offer just because of the size of their schools. So I think they can have the best of all worlds.
Remember, we showed you that 11th grade AP biology class that spends a week out there that Mr.
Right.
Prescott just brought at the last meeting. So
And-
program that's available for a junior back at their home
Right.
state.
And the
And that was the thought, this provides such a solid foundation in science that if a student wants to individualize in certain areas of science or anything, they have that opportunity back at the schools, which the schools offer a wider variety of courses.
Well, how many times have we gotten a kid that, and they do, they go, boy, I'd like to go to AES, but my parents want me to have an IB, option. Well, they're gonna have an option, potentially, it sounds like, of maybe having best of both worlds there. So,
And Mr. Leonard reached out to all 3 high schools and said, I want to make this program a good transition to your academies or whatever you need. And so I know 2 of the 3 schools gave him, direct feedback of what's going to make a good transition to their academy.
And the other factor, when we were discussing the pupil progression plan, we were thinking about the 7, but that gave seniors some options for electives.
Right.
Because they had 32 opportunities to get 24 credits, and now we're singing them back to 28 opportunities. So, but I'm sure even if they finished, we could offer some electives as seniors, but.
well, I can tell you, having a child that we mapped out, the 32, and now mapped out with the new, she has not one
Yeah,
less
thank you.
option
Yeah,
than she did because you had to double up
Yeah.
so many more times with a block schedule that in the end of the day, the options that she had were the same. It was just the way it looked differently. So I'm not disappointed. I will tell you, in our household, that was a real conversation of what's it gonna look like, Dad? And it really doesn't look a lot different.
Well, and one thing that's come up in conversations with me, not in addition to AES, are all the certification programs that we've got. I had a lady very concerned, and we said the certifications are all online. You can look up and see which school has this and this and this and this. But I think we need to do a little bit more of in the fold out that we do before school starts in the summertime, and make sure those certifications are really highlighted and help these children really make choices that they want.
Well, that goes back to
We
my
offer-
pathway
yeah.
guide that I keep talking about,
Yeah.
that they're working, because that's really what we do here, and that's the feedback that we're getting, is that.
Yeah. And right now, most of our high schools have a really pretty thorough process of meeting with students and communicating
Yes.
with parents about, what that student wants and what is the best pathway to meet that.
The questions that we're getting are from the parents that don't come to that and don't get
Yeah.
the paper, and so.
I know that
there's
that's,
still
there's
that
some
level
that
of
think that,
unawareness.
but that's not always what's happening out in the community. There's some opportunities for us to capture some more information, and I think what Ms. Counts is dealing with the same stuff that I am.
Yeah. They want to be spooked in.
Okay,
All right, thank you.
thank you very much.
Can I ask?
Oh,
one
yeah,
more
sure
thing?
can. One more
At
thing.
the summit meeting that we all went to, the consensus was that we, as the schools, participate in some of the litter control of the county, and I know we teach, keep Citrus beautiful at the elementary levels, but they wanted us to encourage maybe some of the groups and clubs at the school or something like that to focus on the amount of litter in our county. So I bring that out because that we're getting along so well. I fear not to not mention it.
Well, we actually had, I can't think of her name right now, from the county commission, the public relations person from the county commission come
Cynthia.
Cynthia Oswald.
also come to our curriculum meeting and discuss some needs of social media videos and pictures and whatnot that our students could possibly create that they could use with the commission. So I know we had a couple of schools, we had several schools reach out initially, and after some clarification, I know we have at least 2 schools that are going to help provide some assistance with the littering, as well as maybe some other things, some advertising for Citrus County.
And I still see signs that this road is being taken care of by, but I don't know, but the by guy must have gone, because the road is not being taken care of.
My guy went by.
So, anyway, just I wanted to make sure that the summit meeting was acknowledged.
Okay, now, I know Mrs. Powers had some things, but Ginger, did you have something
I
on this
just have a
topic?
quick question, no,
Okay,
not,
okay.
not for this. I was wondering if we have scheduled a meeting with our representatives on February 8th.
We have been told by Senator Simpson's office that we would have time, but Senator, or Representative Masulo has not given us the time because they will not know until the week of.
Okay, okay.
And so that is
As long as you
why,
let me know.
and Ms. Fertarami, is there anything else to add to that, or that's pretty much?
That's correct, even with Wilton Simpson's office, they don't get their agenda to that Monday morning of the week y'all go there, and they can't give a time, but they said, Simpson's office said they would work you in for 15 minutes. On that Thursday, they couldn't give us a time frame at this time, and Missoula's office is not responding.
And we talked about, we have to each go individually, Wes said.
Yes.
So 15 minutes is.
But that's
oh,
like
how
what
are
we
you?
did, that's like what we did last year, we went in individually.
We were there all together, but we
went in.
Yeah, we went in, all we met
Discussing.
together, and then we went in and talked individually, right? So the only issue will be with Senator Simpson is that the time is only, what, 15 to 20 minutes is what they've said, but.
And I know you all know this and do this, but you just gotta be contacting them now, sending them concerns, emails, you know, talk to their aides. You know, and then when we go up there, it's their, you know, they just need to continue to know where we stand on it, and most of them do.
And send your thank you notes to the guys that voted for our boards.
Yes.
For what?
CRC.
The salary.
Oh, okay.
Send your thank you notes to those guys.
And I know you all know this, but there are still legislation right now, and, you know, Chris Doolin has sent us out emails on it. There's still an active legislative correction, even though the CRC thing is theoretically dead right now. And we still don't know it'll be on the CRC, because 20 years ago, there were 9 amendments that were put on, 8 were voted yes. So they've got 120-something proposals, who knows where it's gonna go.
All right, Ms. Powers.
Yeah, we're gonna send you a person.
I did send a letter on the other, I think I copied you all on it.
Yeah. Okay, I just had a few statistics. I was at the center's meeting on Saturday when they talked about opioid use. And I brought back some material from you about opioid use and also just about what the center's offers to the county. And, you know, they've had some problems, issues, they've lost money, so they're trying to regroup and present a stronger presence for people in the county to use. But some statistics, I'll be very quick. It said in the country, in the U.S. in 2017, 64,000 people died, up from 52,000 in 2015. And 42,000 of the 64,000 was related to opioid use. The one surprising statistic is
I'm
that coming
thinking
to
my
this
school board
country,
meeting because you called.
there are enough drugs to provide a 30-day supply for each and every human being in the U.S. That's scary. In Florida, there were 5,600 deaths last year from opioid use. And these are the packets I brought back from you, for you. Talks about opioid use, treatment of the Centers for Such or any other place. But then also talks about a lot of other issues that the centers provides treatment from, and other psychiatric or counseling places provide the treatment. So I want you to look at and read it when you have time. And of course, you know that I've always on the kick to bring more social workers and counselors and psychologists into the school because the problem is so severe. And if you catch it early, you have a chance. You catch it late, not much. So, but if you would be good enough to read this, yeah.
You got your own?
Yeah. And a leftover, just pass it back. Yeah.
Wait, did I took the first?
Oh, got it.
It's a very worthwhile conference. You're sitting there and you're listening. Oh, they brought in people who had an opioid, hard to pronounce, problem, and they talked to the group too about them, and that's very brave because that's a pretty tough thing to overcome. Okay, moving on. Thank you. I went to a couple of enhancement councils. One was at Hernando, and they explained the 3-tier approach they use for bringing up reading scores and stuff, very comprehensive, very intense. And I always like to go out there because they always have something they've done that has worked, and they share with us and they share with other schools. It's a very upbeat school. And next I went to Crystal River High School, and again, incredible information. And they're all very excited about these students work together, because everyone's a, rah, rah, go, go, let's win this, whatever it is that we're talking about. But they were talking about giving monies to different groups for teaching. And one thing they mentioned, that Mr. Pistone gave them some information on a super snack program that is administered by the federal government. And so they're able to bring in the students after school, a couple days a week, with maybe as many as 4 teachers to be able to tutor them in math. And their scores in math went way, way, way up, like from the 20s up to the 70s, mid-70s and above. And they want to keep that going, they want to keep that roll going, so they're doing the after-school program. And they're able to have transportation. They have some people who are very into grants, and very into going to the community and asking for stuff, so they have transportation, teachers, and food for the kids coming in to study. So I don't know why anyone wouldn't come in to study with all that going on. So that was quite interesting to listen to. You're very proud of the people in the county when they do all this kind of stuff to service the students. And the other thing I mentioned last time we met was about the presentation that Regina gave, and talking about when she comes before us with students that need to be expelled or dealt with, and talking about maybe not reading to us some of the things, but we have to be able to have that information. So my question is, if truly no one wants to be read to, and we can't read, but where do we get the information? We're given the information right before we have the meeting. We need time to read and digest that information. I just don't want to have it in front of me and no going over and take a vote. I want time to deal with it. The way we're doing it now, I know it might seem like, we're wasting some time. I don't think so. Regina always answers the questions we have. She presents the information, underscores, underlines, emphasizes what's really, really important. And I don't want to lose that. So I know last time we talked about it, I thought maybe we would, but I'm asking y'all, let's not
I
lose
don't
that.
think, Ms. Mullins, I don't think Regina had a problem to have still read. She seemed to, she
No,
was
she-
trying to help us, I think, expedite the process,
Well,
right?
she didn't have a problem.
I think there are some things she's uncomfortable with.
Okay,
Yes, I do.
Okay.
Some words, curse
Okay.
words and stuff
Yes, I
like
do.
that, yeah.
okay,
I think she's uncomfortable with something, but she'll do it if that's what she's.
I understand, yeah, okay.
The other option is we
I'm
could
glad I asked.
be given the folders at the opening, at the start of the meeting, and not have the discussion until,
Give an
we
opportunity.
have 5 minutes to look through it. I mean, I guess we could do that.
You
You're talking about-
need some time, because,
Yeah.
you've got to know exactly what's being said in there. It takes close reading, it's not just a glancing over.
Yeah.
And my concern, because I've been thinking about the same thing, was that silence, and if we have a parent or a student attending, then we're up here reading while they're sitting out there, and that 3, 4, 5 minutes that we're taking to read is gonna seem like 15 or 20 to them. So the anxiety level is gonna go up, where if Regina's reading that, or if those people, if we can get the packets, and there's 4 packets, if we can have 20 minutes before we start and read through all of them. But I'm concerned if high tensions that are already an intensive situation, if we're sitting up here reading, not paying attention to them out there, I'm just thinking that might cause some
Well,
angst
when
on
somebody
them.
was here, I thought we were still gonna read, and my thinking on that was because
Yes.
sometimes it's appropriately shameful for them to hear what they've done and said,
But the student comment,
Um,
parent comment.
Right. If
because it's
they're-
impacting.
Right.
Yeah, okay.
I mean, so I thought that was, but maybe I
No,
was.
that's
Yeah, I
why,
can-
that's
can-
why I thought too.
yeah,
I
I'd
mean,
like
if we're gonna
to
have it
read
contested, or we're
when
gonna have.
there's other people.
Yeah,
It would
If it's
be,
contested, it's more of a hearing than
right.
Well, I think we meant if there was a parent attending.
but that's a hearing. If parents
Um,
attending, they're asking you not to they're asking you not to go with the superintendent's recommendation 90% of the time.
Right,
Yeah.
right.
So they're asking you for a hearing.
So I'd like Gina to continue reading it if it's contested. That'll give us time to,
Well, I think there's two, just for clarification, there's that they haven't signed the stipulated agreement, but they've still come. Some have signed the stipulated agreement and still come, but they're
Some just
asking for
feel-
lenience.
Some just come
Right.
because they feel like it's the right thing to do to
Right,
apologize.
To see us.
to the board and,
yeah, the one dad came.
yeah.
And some, you're right, some will come to stipulated just to say, I apologize.
Right. And I know we don't have a lot of those, but we do have
in
them.
the past.
We
We
have
have them.
I thought if they came, it kind of rose it to more of a little more formal
It is.
attempt, than if they, than if we're just reading it to ourselves. I can support the board in either direction. I understand though that there's words that can be uncomfortable to be spoken.
Well, we definitely have to have time to look at the material. I think we all agree that if there's a parent or if there's anyone here in the hearing format, then it'll be more the formal hearing with reading everything.
And if it's not, I don't object to it. I know dealing with literature, there's words too that we would not use in the classroom. You'd always preload that if you were gonna teach that particular essay. And I don't have any objections to Regina not reading aloud words that she
Yeah.
has any.
I don't even.
I mean, we could
I
see
think I
it.
would probably ask Wes before we made that decision. If
Oh.
she could leave out, because if she's reading it as a statement from the student, I don't know if she can do that.
Yeah, okay.
Well, then let's do S again.
We'd have to ask Wes if that would be appropriate.
Either you have to read it or
Either-
not read
yeah,
it.
Either read it or not read it, but if you read it,
You have to read it in its entirety.
I would think you have to read it. I bet just my.
On TV, they just go blip.
Yeah, just the first letter, last
She
letter.
could go
right,
blip.
and put some-
I can remember I could always count on Sherry Churnich right before she'd be, excuse my, and then she'd
Yes, that's right.
to say a litany of things that you're like, whoa!
But I do find that certain pieces of literature that children really listen very, very carefully, just in case I would make a mistake and say a word. They were tuned in.
So we're going to refer it on to Wes and have him give us a legal read on it. Whether or not you can
Yeah, I'll
leave
talk
out
to
the words,
Wes.
that would be good. But I know, I want to make sure I read all of that
Yeah,
stuff.
and if we're alone in here without the parents, I don't have any problem reading on my own as long as I have enough time.
Right, as long as we give enough time to look over it. Okay, that sounds good. So we'll find out about if we have contested or if someone is here to apologize or whatever, we'll go the formal route and you can find out if what can be read. Mr. Mullen, you can ask.
I'll find out.
Okay.
And the last thing I have, I'm not gonna go into because I think some of y'all can go into it, but we went to the community awareness and education forum, which I found to be very beneficial. There are many, many positive things said about the school board and what we do and how we function, and I was appreciative of all of that, so I know one of you will say something about what was there, so.
You're talking about the elected officer summit?
Yes.
Yeah,
Oh,
well,
yeah.
it seemed like last year, they all wanted to talk about education, wasn't it? I mean, this year it was
Yeah,
more
because we had
even.
the impact fee problem.
Yeah, it's true.
But, yeah, I mean, I think, one thing when we talked about those quality of life issues, nobody can say we don't have a strong school system, great school system. I mean, the reputation is very strong for our schools.
And my husband and others are in real estate, and people come here for the schools. They
Yes.
want a house in a certain district. If we buy this house, where will my child go to
Right.
school?
Yeah.
Very, very impactful.
And we have a predominance with the Key Training Center.
Yes, we
people
do.
Selecting
Yes,
Citrus
we do.
County as all.
But it does seem like we have a pretty cooperative group. I mean, even our legislative, the senator and the representative, they're very much listeners, right? I mean,
I think everybody wants to work together. I think
Yes.
everybody.
Well, Scott wrote down, when you said 311 and.
Yes,
he
He
did.
wrote it down, he
Yeah.
said, what, and he double checked to make sure that the commissioners were going to notice Tallahassee.
And I do think the one sometimes unintentional disconnection is our job for economic development is having great schools.
Right.
And we kind of do that because that's our job. And I mean, that's just been what we do.
That is what we do.
We also create, again, you know, successfully a strong workforce. If they're not tapping into that, that's a conversation to have. And you brought up some great suggestions, but I hope they continue to recognize we have students that want opportunities, but you can't just kind of wish them out there without trying to go after
We
them.
have to put help wanted signs in front of all of our schools. And then but not in Crystal River because they have a signage.
That was it. That was brought up.
I didn't suggest that we put signs in front of all of our schools.
It was a good meeting, and Mr. Dodd, you did an excellent job at facilitating, and you were a great statesman for us.
Well, I think we all are do a very good job with, you know, communicating with the public, and we all had different topics to cover, so I thought it was very well done. I know, when I read the article in the paper on the mental health, you know, Ms. Powers is so much a part of that, and I wish there would have been a little more information that she had shared in there, because she was one of the, I think, the first one that started out talking about
It
mental health.
continued through the entire meeting.
Yes, it did.
Yes.
Yes, it did,
We
yeah.
have everybody
So-
on board.
So are you speaking Thursday night?
Oh,
Oh, Galaxy of the Stars.
Yeah.
Yes, yes.
So you
We're-
get to
we're all-
speak 2 years in a row, this
We're,
is
we're,
excellent.
we're all gonna be there,
I
correct?
think we are.
Yeah.
Okay, okay.
I did my FISBIT this last week.
That's
I get
right,
to come.
okay,
I'm
good,
so
good,
excited.
good. Yeah, last year, we had
I
what, two
forgot,
county
yeah.
commissioners there last year, didn't we?
Oh, because
Scott
that's right, Scott
Carnahan,
Carnahan and
And
you.
then, and I think, no, I think we had three county commissioners. I think Brian
Kitchen.
Coleman and Ron Kitchen were there.
Yeah.
Right, yeah.
Ryan Coleman, I just, again, a standout, and I know it's easy because he's a brother of yours, but boy, he just seems to, he's just ready to be a part of this,
Yep.
you know, to work with the school district. He understands the need of, you know, obviously the Baker Actings and the impact
Yep.
of that from the school districts, and it's just, he's a great person there, and I'm grateful that we have him on that commission.
Yes. All right, Ms. Powers, is there anything else? Anyone else? Okay, all right, well, we stand adjourned.
All right.
Thank you so much.
55 minutes later, you said to vote.